Hello, my name is Michael Mendez, and today I will be presenting the case study number one. It is about a 30-year-old man who had an above elbow amputation, and he was experiencing a neurological condition known as phantom limb pain. Phantom limb pain is essentially you feel pain in the presence in an absent limb. The patient would describe it as him feeling a sort of electrical and cramping pain in his absent limb, and he would describe it as it occurring quite frequently, and he would say the pain was quite immense, to the point where you can see here in the photo with the smiley faces. That is known as the visual analog scale. It is basically a scale of pain or discomfort, and he will describe it as an 8 to a 10. Um, the patient would try various methods in order to relieve himself of this pain, such as going through pharmaceutical methods, such as taking oxycodone and amitriptyline. They're basically pain medication for people who have nerve issues, and that was found to be ineffective. He would also try out spinal cord stimulation, which is essentially putting pacemakers underneath your skin and basically shocking the spinal cord in order to disrupt the pain signals going to your brain. Um, that would also be ineffective, and he wouldn't find something that worked for him until he did mirror therapy. Mirror therapy, essentially, what it is as seen in this photo. The amputee will put his absent limb on the other side of the mirror where it's covered, and on the other side, he will put his limb that's still there, and he will have it reflect on the mirror. This proved to work quite well for the patient, as his pain went from 8 to a 10 to a 7 to a 5 to a 4. This is with months of going to mirror therapy. And the reason why this works so well is because the patient is essentially getting a visual feedback, because he's looking at the mirror that's giving the illusion that his arm is still there. But in reality, it's not. Because what the patient was feeling before, he was feeling some somatosensory feedback in which he sees his arm isn't there. So the brain begins to panic and believe there's something is wrong. So he will begin to feel pain there. This is because of our mirror neurons. And essentially what mirror neurons do for us is, one, it allows us to observe people doing things, doing some sort of task, and it allows us to copy it. Also, it allows us to differentiate between left and right. That's very important, because if our mirror neurons are telling us that to our left that an absent arm isn't there, we're gonna begin to feel pain. But if we can trick those neurons to believing that the arm is still there, then the patient won't feel any pain. And this is possible because mirror neurons can reorganize. Overall, mirror therapy is super effective in decreasing phantom limb pain. However, it's not a complete solution, as the patient was still left with some moderate pain, but it should not be denied how effective mirror therapy is.